So our next team is going to be Dr.Swapna Nair from Chaitanya Group of Hospitals. She is the medical director and a leading cataract, cornea and refractive surgeon. And I must congratulate the whole Chaitanya Group for completing their Silver Jubilee 25 years of successful service in the eye care. Congratulations, madam. And she would be speaking on, I would prefer to use Barrett's formula in all my IOL power calculations. And her opponent is Dr. Amit Gupta, a senior cataract, cornea and refractive surgeons from the prestigious Postgraduate Institute of Ophthalmology, Chandigarh, to talk against the motion. Over to Dr. Swapna, please.
So let me just share my screen. Is my screen visible now?
Yes, yes, yes.
Good afternoon, ladies and gentlemen. Thank you, Chitra ma'am, for having me here. And yes, I would like to use Barrett for all my IOL power calculations. Now, why? Because Barrett is not a single formula. It is a repertoire formulae. So you have the Barrett Universal 2 along with the Toric and the Total Keratometry Universal 2 and Total Keratometry Toric, which form the Barrett suite along with Barrett True K and the Barrett treatment formula, True K for refractive, post-refractive cases, and treatment formula to align toric IOLs that may be giving you residual power. So now here you have a whole range of treatment conditions that you can treat, conditions that you can deal with using the Barrett formula. Now, this slide is basically to highlight that this formula need not only be used with optical biometry, but is compatible with contact ultrasound A scan as well. Now, I'll come to that a bit more later. So this is it's a part of a master chart that we did a study for using Barrett Universal 2 for both optical as well as ultrasound axial lengths. So one is the lens star on one side, immersion on the other, and you can see that even when you incorporate the axial length and the other values like the lens thickness or the ACDs obtained from the immersion into the Barrett Universal 2, you get very similar values in both cases, both optical and ultrasound. So that proves that it is a formula. It's a truly universal formula. Now, coming to special situation, here I'd like to highlight a couple of cases where the usefulness and the versatility of this formula is proved. So coming to premium IOLs, now this is a patient who required a panoptics, and you can see that across all machines, the lens star on the left and the anterior on the right, you get similar values, though the patient is a myope. Now, in Toric calculations, Barrett Toric calculator has been incorporated into the calculators of nearly all the major companies that provide Toric IOLs, which itself is a testimony to the fact that it is a good formula incorporating the posterior corneal astigmatism as well into calculations. You get the sphericity, the toricity, as well as the intraocular lens alignment that is required using this calculator. Now, this is a silicone oil-filled eye, and an immersion scan has been done. And you can see that the IOL power that we gather is 25 diopters over here, whereas now the same eye underwent a Barrett calculation. You can see that the power is 22.5. So this variability, the consistency with the Barrett, 22.5 was the right value. Now, why it happens to be so is that when you use the optical scan and the corresponding formula, you're avoiding the fluid oil interface, and because the patient is sitting, that error induced by the probe is avoided. Now, post-refractive surgery cases are very dicey to deal with, especially they are much on the rise right now. So you can see on the right side, you have an ultrasound, which gives you something to the tune of 8 diopters as intraocular lens power, all the way to 10.5 on optical. But the ACRS calculator, which is pretty accurate in a lot of cases, you can see gives you a power very near plus 13 diopters. And if you look to the left below the chart, you have the Barrett True K formula there, which also gives you exactly the same power. So the ACRS gives you an average of all these formulae, whereas the Barrett in itself has calculated the same power for the patient. Now, with respect to axial length, if you look at this chart, which has been shown very often, you can see that Barrett 2 is the only one which does not require modification across all axial lengths. There has been some skepticism regarding hypermetropia. But if you see this chart, you'll see that Hoffer Q, which gives the correct value of 25 diopters with the ultrasound, is corroborated by Barrett's on the right with the same IOL power. And dense cataracts, of course, the composite algorithms of all optical instruments can calculate power. So it can be used even in dense cataracts. So this is basically to show that it is a truly universal formula. It has multiple factors factored in and therefore gives very consistent and persistently optimal results. Thank you very much. And thank you, Dr. Srinivas, for that nice introduction.
Thank you, madam, for that lucid presentation. Thank you very much. You gave most of the points in just 5 minutes.